is Dr. Stephanie Mulick. I work at Tayani Institute, and we just went over home page, intake, and now we're going to move on to history. So Histories page in Nextgen, we can review their past ocular history. I did talk about that in the intake page, but it's always good to double check. So this is another page on the histories where you can confirm that you wrote in any past ocular history. If they don't have any past ocular history, this one won't allow us to do it, but you can click no. If there's already history there, like a cataract and myopia, LASIK, then you cannot click no. Once everything's in there, you can hit review no change, or if you updated it. If you need to add anything, you just click add, and you can add anything. So let's say they have cataract surgery, you could click on cataract here, and then you can click cataract under the disease. You can decide if it was the right or left eye. It's not uncommon for someone to have just one eye. You can say they hurt their right eye. This next date is the date of diagnosis, which typically most people don't remember, but if at least we can put in their cataract surgery. If they don't know what type of cataract surgery, you could potentially put cataract surgery. Nowadays, most people have what's called phaco with a PCIOL, but it's fine to put cataract surgery if you're unsure or they are unsure. Again, they say the eye, and then if the procedure date, a lot of times they're not going to remember the exact date, but if they have an idea, even if it's just the year, if it was a long time ago, they may say, oh, it was around 2005. If they have an idea of the date, you can always add the date too. You can just free type it. So August 5th, 2005. You can be precise, or you can just say August 2005. So that's an example, and then you can save it there and close. And then it adds it to this grid, and then we can say now we reviewed and updated because we just added one more thing. Now when we scroll down, we have our pertinent medical history. So on our forms at Tayani Institute, we have all of these things listed. So when a new patient comes in, it should be documented on their form, making it easy for us to know. But if you need to add something in the medical history, let's say they have allergies, so you can hit allergies. It's not uncommon for a patient to see the eye doctor for diabetes, so you can click diabetes on here. If they happen to know the date they were diagnosed, that is helpful as well, or at least a year. You can say they were diagnosed in 2002. It's a good thing to know. If they have high blood pressure, any kind of disease here, or if there's something not listed that needs to be written down, you can hand type it here. So any other condition can be written down. And then you can go add to grid. So then once you add it to the grid, you'll see it. You should see it. It didn't add. So let's go back and check why it didn't add. I'm going to go back here, and I feel like okay. Allergies. We said diabetes in 2002. Save and close. We're going to add to grid. Oh, I know why it didn't add, so that was good. So we need to hit OK right here instead of Xing out. So once I hit OK, it actually did add the conditions there. And under this history review, this little blue thing, you want to click it. And if you updated anything, make sure to hit reviewed and updated. Or if you just reviewed but there was no change, just put reviewed and no change. And then you're going to save and close. Okay, the next one is family history. So again, on our new patient forms, it's pretty specific. If they don't have any family history of any eye disease or diabetes, then we can just put no relevant history. If they were adopted, you can click in adopted and that they don't know their family history. Or if they know that their paternal grandfather had glaucoma, you can go here and put relation, and then you're going to say paternal grandfather glaucoma, and you can save to the grid and then save and close. And now it's listed paternal grandfather with glaucoma. Smoking is something that must be asked. Sometimes people don't like to be asked that, but it's required. So we have to hit add and edit under smoking. This one already says no, but you still want to ask again because you never know if they started or if they were untruthful. So we can say, do you currently smoke or have you ever smoked in the past? And then they may say, oh, yes, I smoked in the past. So if you hit yes, all of a sudden the smoking status changes to unknown, and you don't want it to say unknown. So if you click on it, it'll give you a list of things. You can put current everyday smoker or former smoker. So if it's a current smoker, you can put current smoker, like I said, or if you put former, then you're good. But if it's current smoker, there's one more thing we have to do. If it's a former smoker, they've already quit. We don't have to do this, but we have to scroll down to this little area that says tobacco cessation information, and you have to say tobacco cessation was discussed, and we can say smoking cessation education, which typically I say, oh, I didn't add it to grid, so smoking cessation, and then add. Once you hit add, you can hit save and close. And apparently I did it twice, but that's okay. And so that's all we have to do on that smoking. If we put no, or if we put former, then you don't have to do smoking cessation. It's only if the patient is currently a smoker. We need to verify that we told them. And the main risk for our eyes is what I usually tell them is it's a high risk for macular degeneration. It's one of the risk factors, as well as many other health conditions. So we can just click that in there and exit out. And you are now done with the Histories tab.